End-of-life doulas and the rest of 2020. Stay tuned. It's good to give a little context here. I'd like to start around, say, 20 years ago when there was nothing going on, nothing in the end-of-life doula space. There was not much talk about pre-hospice palliative care. There was not much talk about hospice even though they were around a good 30 years, but still it was slow. And there was not much talk about advanced directives or anything of the sort. That's when I entered in this area. My heart was about teaching palliative care. There were people all around the world bringing in, never stopping teaching about green burials, the environment, and empowering people to bring dying home, to take care of their own. This has been going on for years, never stopped. We might not have seen them on the internet, but they were there. Everybody was doing their part. And as this movement grew, of bringing death into awareness, of taking care of our own dying and our own dead, bringing dying home instead of in the hospitals, trying all these heroic measures for a person who's actually dying. It's appropriate when they're not actually dying, or when someone's had an accident or a stroke or something and they're trying to turn that around. But when someone's actually dying, we have been trying to change that scenario to being peaceful at home, not all those heroic measures, because it's inappropriate at that time. So we have all of these things going on. I've been a part of it since those days, and so grateful to have seen the evolution, where in the last few years there are many, many people with many angles and skills and gifts to share with the world. Platforms that are being built that will tie us all together in ways we've never had before. Very exciting times. So that's where we've been. What we've known and realized along the way, there's not enough time in our system to discuss full options, to support people fully as they're dying. Many wonderful books have been written about that, about bringing palliative care into people's care plan from day one of diagnosis. We have Dr. Ira Byock talking about that, Wanda talking about, Dr. Jessica Zitter. There's so many, Timothy Ehrig, BJ Miller. There's so many people talking about this reality that we need to reduce suffering, that the present healthcare system needs help. Even our present hospice system needs help. They're being squeezed as well. So now we have all of that happening. Now bring in this concept of the silver tsunami. We have been talking about that for the last 10 years. We have the Association of Death Education and Counseling talking about this for many years, bringing research and bringing in the awareness of thanatology and that discipline. And Home Funeral, the National Home Funeral Alliance. We have many aspects of this dying well movement that is supportive of each other. Now, the end-of-life doula movement, which is so beautiful about this, is this role actually ties everybody together. Who has the time and the end-of-life experience and savvy to help bridge the gaps that everybody's saying is there? The lay people have the stories of their loved ones going through it, and the professionals are writing books about it. Hospice is saying that they need more support and more help. Everybody's talking about it. So there's no argument there. The question is, who's going to do it? End-of-life doulas are going to do it. Death doulas are going to do it. Yes, this is a new role. When I was doing it in 2005, nobody that I knew was doing it in this country that called themselves an end-of-life doula in private practice. Well, now it's in the public consciousness. Google end-of-life doula, death doula, and we're everywhere. Tons of articles, tons of services, many people thinking about it, talking about it. So when we first began, it wasn't so much about creating a role. That wasn't the intention. That wasn't my intention anyway. It was about sharing how to accompany the dying well, how to help people help their own. Die well, bring dying home, so that people felt comfortable and confident to take care of their own loved ones at home or in the hospital or in the nursing home, wherever they were, that they didn't feel lost, because we weren't taught in these last 30, 40 years how to die well at home, because everybody's been going to the hospital with the latest medical marvels trying to stay alive. So this consciousness about trying to stay alive at all costs, we've seen the foolishness of that. Now it's trying to systematically and consciously and with wisdom know when to let go and when to keep fighting. So that's been the quandary. So that's where we all are. So the silver tsunami is about this disproportionate amount of people than we've ever had before will be dying and aging. The older people will outnumber the younger people for the first time in history. There will be more people over 65 than there are under 18. So the end-of-life doulas and death doulas have been focusing on helping that group, which is going to be more and more and more demand for that over the next 10, 20 years. It's already starting. It's already starting. We're already out there helping people in that realm. And then COVID happened. The simple answer is that people that want to be part of advocating, empowering families, serving families, they have a heart for being with people at the end of life, have been coming around. I've seen it for 20 years, and even more so the last 5, coming in droves. I want to be part of the solution. And I want to be part of this in a bigger way than just volunteering for a couple of hours once a week. I want to do this for a living. I want to do this, but I have to make a living. So wanting to bring this together has been something that we've all seen. This is not something that trainers are creating. This is something that people coming to me, for instance, saying, I want to do this and I need to make a living. How can I do both? So that's been the question of the day for the last, 5 years or so in a very big way. People are trying to figure this out. Okay. So we have a large group of people coming more and more every day that want to do something to empower and to support and to serve at the end of life. Well, here comes COVID. It stopped us all in our tracks. The whole world stopped in their tracks when this happened. In this country, it was around March, right? When we just all stopped in our tracks. Everybody is like holding their breath, wondering what in the world is going to happen. We still don't know. But this is what's happening for death doulas, what we're seeing, what I'm seeing. I've had my finger on the pulse of this since the beginning, having conversations, public conversations, private conversations. Every one of us has been doing our own way of healing and supporting ourselves, our own families, and our communities. We've been doing what we can. What I have seen from all of this is that end-of-life doulas, death doulas, we're needed now more than ever. Because now, for the next few years, we need to help take care of the people who have been traumatically affected by COVID, period. I recommend pre-death, during death, and post-death accompaniment. So there needs to be a peace flowing through the whole time, from when you meet somebody and through dying and after death. And my recommendation was always at least a month after, just to help people get through that time period where they might be having their services, their burials, things like that. Well, with COVID, the people that have been affected by COVID have a new level of trauma. They haven't been able to see their loved ones, be with their loved ones, accompany their loved ones before, during, and after death. They're not able to gather. They weren't able to go. This is a whole level of trauma outside of the shock of the dying quickly, which COVID does for people. Also, there are people getting new diagnoses of cancer and dying during COVID, and nobody can be part of anything. That happened to our family. There are many things going on that we are in a new day. The skills that doulas have are appropriate and keen and perfect right now. The skills and the love and the passion that people who go for end-of-life doula training or incorporate their present skill set and know that that's who they are and they're coming out are perfect to help people in the post-COVID trauma times. Are we bereavement counselors? No. Are we chaplains? No. Some of us are, but most people, let's just assume that they're not. The end-of-life doula role is a non-medical role. And the way I teach accompaniment in this role professionally is that we're deep listeners. We're deep listeners. We're curious. We don't come with a template of what to do's and all of that. That's ridiculous. We come with our heart. We come curious. We come to witness and to accompany, walking alongside. Okay, perfect for someone in bereavement, even more perfect for someone in trauma. So a person who accompanies is needed now more than ever. If you're a person, because also some people are drawn to the time period around diagnosis, some people are really drawn to the time period when treatments begin to really stop working and before hospice entry, and some people are really drawn to work with people in that pre-death time period, that vigil time period, and some people are really drawn to work with people in the post-death time period, the immediate early bereavement time period, and some people want to journey over a long period of time with people in bereavement. Right now, regardless of which place you really want to hone in on, it's my belief that every doula should have a long-term bereavement plan in their practice for the people who have been directly impacted by COVID in one way or another. They have a different level of trauma. We'll be able to help them by accompanying them through the shock of it all. We're still not out of collective shock, many of us. What the reality is, we still don't know what's coming. It's still very early in the game. We're still in shock, so many of us, of what's just happened. What was that? And trying to make sense of it all. And many of us are doing a pivot in our own lives. There are many people devastated by this, financially and every other way. So those of us who have the energy and the capacity and have overflow to give, that call ourselves death doulas, end-of-life doulas, it is my belief, it's our responsibility to step up in COVID times and be focused on this post-death period. We're not letting go of the pre-death period. We're taking in the post-death period long after early bereavement for those people who are impacted. How are we going to do this? That's for us to figure out together. We're doing that in my school, and we are talking about this every week as we get new awarenesses. As you get new awareness, be thinking about, well, how is this going to look now? There are many people, many death doulas saying, well, what do I do now? I have to wait till COVID's over. No waiting till COVID's over. COVID's not going to be over, ever. So now all of us are going, okay, now that COVID is here, what am I going to do to support? There are way more options than just hospice won't let me go volunteer right now. We have more options than that. Each one of us can reach out to our communities around us. Now it has to be phone, it has to be social media, it has to be Zoom calls, cars around in a circle 6 feet apart. There's many ways now that we can do it, because before we did it in person. We went to networking meetings. We were in groups. That was the easy way. It's not everybody's bag of tea anyway, but we don't have that anymore. But there are online groups. What did you do offline? Do it online. How did you reach out before? Reach out now. Because you can't accompany someone in person doesn't mean you can't accompany them. I know it's not perfect. This is a new reality. How can an end-of-life doula be helpful? We still need to help people pre-plan. We still are liaisons and we're still advocates. We still provide care services. We still help with bereavement and companioning people through things. So we are still able to do this enormous realm, standing in the gap for our healthcare agencies who are unable to do so on this level. The whole thing has always been time. So when hospice came into being, they were first a volunteer service and helped people and were with them in time. They still are that. Now they're a consultancy service. They're not caregiving service. Their time is built in much more than it is for healthcare in the hospitals and home health and clinics. You know how fast that system is. That system is high turnaround. You get 5 minutes, if you're lucky 10, and they need to go to the next person. Hospice, palliative care, builds time into the picture. So now you've got time. People have never had as much time with a healthcare professional than they have with hospice. Okay, well, hospice is getting squeezed. They're getting overburdened right now. Who has the time? Doulas do. So because of the National Hospice and Palliative Care Organization's foresight, because of CEO John Masterjohn at the time, they invited doulas to the table by creating a board, End of Life Doula Advisory Council. Very honored to be the chair, the first chair of this council. And what we're doing is we're educating hospices and palliative care organizations in this country about end of life doulas and the role that we can play and how we can be helpful to hospices. We're all learning together because now we have a different day and time. When the council was created in April 2018, there was no COVID. March 2020, the world has changed and will forever be changed. We're going to have to move with it. We're going to have to grow with it. We're going to put our heads and hearts and hands together and figure this out together. Is it a different day? Yes. Do you need to wait? No. Right? So this is a beautiful time of innovation. It's a time when there's now the people that are waiting, they've been waiting for years. They'll call me and go, I'm still in the living room. I haven't gone out yet. I'm scared or whatever. A lot of those people are coming out and saying the time is now. The time is now. The time is now. Whether you want to do it on your own, whether you want to be part of an end-of-life doula training, whether you already have the skill set and you already have the connections and you're going to figure it out on by yourself, the time is now. It doesn't matter how you do it. But I want you to know that together we're going to figure it out step by step. Every week is a new week. Every week we have more awareness about how we are, how our family's affected, how we're affected. We're seeing how the effects are in our communities, in our friend circle, in our family circle, in our work circle. So as a person who's naturally drawn to helping people through dying, through grief, we are the perfect role. And we're going to come into public awareness even stronger, even stronger. People are going to start relying on us. I wish I could remember her name, and if she watches this, please post it here. She's trying to petition for end-of-life doulas to become an essential worker. So that way we can be part of the ground crew, those of us who want to, those of us who are healthy and can. She's trying to make this happen for us. So that's very good. So many people this is why we're all needed. So many people are doing different things from different aspects, different angles, a different voice that enables all of us to hear and all of us to participate. Thank you for your time. Thank you for listening. Listen to your own heart. If you want to be part of this, come on. If you want further training, I'm here. Okay, so just let me know. Take good care and do keep in touch. Let me know how this is affecting you. I want to be a help to you. How can we help you? That's the main thing that end-of-life doulas are here for. That's our whole mission. We're a non-medical role here to serve emotional, practical support, education, and guidance. How can we serve you?